Anemia is defined as decreased concentration of hemoglobin for the age and sex of the individual, that is below 13 grams per deciliter in adult males, 12 grams per deciliter in adult females, 11 grams per deciliter in children, and below 13.5 grams per deciliter in the first week of life. Anemia always has a cause, which must be identified and properly managed. The cause must be investigated before initiating treatment. An emergency, blood samples must be taken for investigations before blood transfusion. Causes: nutritional micronutrient and vitamin deficiency, normally it's from iron, folic acid, and vitamin B12 deficiencies. Also bleeding, heavy menstruation, hemorrhoids or piles, peptic ulcer, infestations, for example hookworm, bilharzia, and also solid organ malignant tumors, for example colonic cancer, and hematological malignancies, for example leukemia, hemolysis, severe malaria, sickle cell disease, GSPD deficiency, hypersplenism, autoimmune conditions, and also drugs. For bone marrow failure and disease infiltration, for example leukemia, lymphoma, tuberculosis. Also for aplasia, primary or secondary, due to cytotoxics. So chronic diseases could also lead to anemia, for example kidney disease, tuberculosis, hypothyroidism, autoimmune conditions too, SLE, systemic lupus erythematosus, and pernicious anemia. Okay, so the symptoms usually include easy fatigability, dizziness, shortness of breath on exertion, palpitations, fresh blood in stools, black tarry stools, that's melena stools, and hematuria, and also cooler-like urine. Signs that are usually elicited include pale mucous membranes and palms, angular stomatitis, also spoon-shaped and raised finger and toenails. Sometimes plain liver and lymph nodes may be palpable. Signs of heart failure in severe anemia, jaundice, normally in hemolysis, petechiae and purpura in bone marrow failure, and hyperpigmentation of palms and soles of feet. Investigations: FBC, that's full blood count, reticulocyte count and blood film comment, sickling test and HB electrophoresis if indicated, blood film for malaria parasites, kidney function test, serum iron, vitamin B12, and folate levels, direct Combs test, stool for hookworm ova, stool for occult blood, urine for schistosoma ova. Specialized tests depending on the suspected cause, for example bone marrow examination, antinuclear antibody test, that's another test, and upper and lower GI endoscopy. Treatment: so the main treatment objectives are to treat underlying cause of the anemia and to restore hemoglobin levels to normal, to replenish iron stores after correction of anemia in iron deficiency, and also to restore hemoglobin to steady state level in sickle cell disease patients. Finally, to correct anemia, improving vitamin B12 and folate deficiency, and also to maintain normal levels throughout life. Non-pharmacological treatment: advise on a balanced diet, regular intake of leafy foods as well as fresh fruits and vegetables, beans, liver, meat, eggs, and fish. Also, high fiber diets to reduce bleeding from hemorrhoids, and surgical treatment where applicable. For example, hemorrhoids, tumors, hypersplenism. Pharmacological treatment for iron deficiency anemia. First line treatment: you give ferrous sulfate, dried or anhydrous oral in adults, 200 milligrams, as 65 milligrams elemental iron, 8 hourly for 3 to 6 months. For children with age greater than 10 years, you give 200 milligrams 12 hourly for 3 to 6 months. 8 to 10 years, you give 200 milligrams daily for 3 to 6 months. And from 5 to 7 years, you give 80 to 120 milligrams 8 to 12 hourly for 3 to 6 months. And for 1 to 4 years, give 45 to 90 milligrams 8 to 12 hourly for 3 to 6 months. Less than a year, you give 30 to 60 milligrams 8 to 12 hourly for 3 to 6 months. Or you can also give ferrous fumarate oral in adults, 200 milligrams, 65 milligrams elemental iron, 8 hourly. For children, 3 to 6 milligrams elemental iron per kilogram per day for 3 to 6 months. Second line treatment, you can give iron sucrose IV. Okay. So parenteral iron has no advantage over oral iron preparations except in the rare case of malabsorption. Okay, so for the iron sucrose IV, you give as a slow bolus ingestion over 2 to 5 minutes. In adults, 200 milligrams every 3 days for 5 doses. And in children, 0.5 milligrams per kilogram every 4 weeks for 12 weeks. The maximum dosage as 100 milligrams per dose, calculated based on body weight and iron deficit, and also the target HB. Or you could also give iron dextran IV as a slow bolus or IM by deep intramuscular injection. In adults, 25 to 100 milligrams daily as needed. In children, is not recommended. For vitamin B12 deficiency, you give vitamin B12 as hydroxycobalamin IM. Okay, in adults, 1 milligram every other day for 6 doses, and then you give 1 milligram every 3 months for life. In children, you give 1 milligram start, and then 1 milligram every 3 months for life. For folate deficiency, you give folic acid oral. In adults, 5 milligrams daily. In children, 2.5 to 5 milligrams daily. For severe symptomatic anemia, you give blood transfusion with packed cells. Then treat for cardiac failure if signs of cardiac failure. Okay, so referral criteria: refer patients with hemoglobin levels that do not improve after 2 weeks on the above treatment, or when severe anemia from any cause which recurs to a specialist. Also, patients with suspected aplastic anemia or anemia due to uncontrolled bleeding, including heavy menstrual loss, would also require referral to a specialist.